Amplify is a multicenter phase 3 randomized trial testing the combination of acalabrutinib and venetoclax with or without the anti-CD20 antibody obinutuzumab in CLL. The patient population are previously untreated fit patients with low comorbidity scores and who do not have deletion 17p or p53 aberration. At ASH this year, we're presenting the first interim analysis, which is a 40.8-month follow-up, 3-year landmark estimates for the survival curves. And the primary endpoint of the study was progression-free survival comparing the acalabrutinib venetoclax to the chemoimmunotherapy arm. There was a statistical hierarchy where there are a number of key secondary endpoints. The next one was the AVO, acalabrutinib venetoclax obinutuzumab, compared to chemoimmunotherapy, followed by minimal residual disease endpoints for AV and AVO, and then overall survival endpoints for AV and AVO. So the progression-free survival for AV was significantly improved compared to the chemoimmunotherapy arm. This was by independent central review, and also for AVO as well. The 3-year landmark estimates were 83% for AVO, 76.5% for AV, and 66.5% for the chemoimmunotherapy arm. Both experimental arms, as I said, were significantly improved compared to the chemoimmunotherapy. There was no planned comparison of the two experimental arms. Obviously, the point estimate looks a little higher for AVO compared to AV. This was not translated in the overall survival, though, where overall survival was best for AV and was in fact statistically significantly improved compared to the chemoimmunotherapy. Some of that may be due to the fact that the study was carried on at the height of the pandemic, and there were COVID deaths, which were more on the AVO and chemoimmunotherapy arms compared to the AV, probably because of the anti-CD20 antibodies. The AV arm was also extremely well tolerated. Only about 25% of patients had serious adverse events. The most common toxicity was neutropenia, which was generally easily manageable. There were only low rates of BTK-related toxicities, such as cardiac events or hemorrhage. So overall, Amplify showed a statistically significantly improved progression-free survival for AV and AVO compared to FCR/BR in fit treatment-naive patients with CLL. The trial is registrational, so we hope that these regimens will be approved sometime next year.